Have you ever been jolted awake in the middle of the night with a painful foot or leg cramp? Well, I have, and it's horrible. If you're wondering what's going on and what can you do about it, well, stay with me in this episode. I'm going to share the 3 root causes and the simple thing you can do at home to prevent it. Hi, it's Dr. Gaffney, saving you time and money in your foot health decisions. So if you want to get rid of your muscle cramps, you have to treat the root cause. And we're going to go into the 3 most common categories of causing muscle cramping. And 50% of Americans do have muscle cramps. And it's on the rise because there's magnesium deficiency that's rampant in the population, mainly because the soil has become more and more deficient in magnesium. Therefore, the plants are more deficient, and then we're more deficient. So that leads us to the first category, which is metabolic cause of muscle cramps. So this is just an alteration in all the chemicals that are involved in muscle contraction. So that's potassium, sodium, magnesium, calcium, and that all can be affected through different chronic health conditions like renal disease or kidney disease, heart disease, thyroid disease. So those are more common chronic causes that affect those electrolytes or those little chemicals that are involved in muscle contraction. Also, there can be temporary conditions that affect those electrolytes, like pregnancy or dehydration, muscle fatigue from overactivity, and of course, medications can cause it as well. So it's really important to be working with your doctor to figure out what's going on. Your doctor will have to draw some blood work to measure those electrolytes to see if any is out of whack and what you need to do to get it back in range. It really needs to be precise and fine-tuned for bodily function. And you don't want to go and start taking supplements on your own without working with your doctor, because these electrolytes have to be in proper range to be fine-tuned. Otherwise, it can result in some serious health consequences. Second root cause of muscle cramping is vascular, meaning poor blood flow to your lower leg and your foot. And the arteries that come out of your heart have to go a real long way to get down there to your lower leg and your foot. And as they travel down the body, the little pipe gets smaller and smaller and smaller. And the arteries are what bring you the oxygen and nutrients to your muscles. So in this case, your doctor has to examine you and look for the findings. And those findings are discoloration of the skin, abnormal texture of the skin, thickening of the nails, loss of hair in the lower leg and the foot. Next, your doctor would probably order an arterial study, and that's just basically blood pressure measurements down the leg and to the ankle, and ultrasound measuring the flow of the blood through the artery, just to get a rough idea if there's a blockage. If your doctor does find a blockage, the next thing they usually do is a CT angiogram, and that's when they put dye inside the arteries and take a picture with the CT scanner and pinpoint the area of blockage. If there is a blockage, what they do next is either the vascular doctor will put like a little balloon in there to open up the artery and let the blood flow through, or he might even put like a little stent to hold open the artery and let the blood flow through. And we are blessed today to have modern medicine, because when I first started training, we didn't have a whole lot of angioplasty and stenting, and people had to go through like a major bypass surgery to bring blood flow past the area of blockage. They still need to do that nowadays, but not as often. The last root cause of muscle cramping is neurological. And so this involves like pathology in the back, like spinal stenosis or a slip disc pressing on the nerve, and then the nerve signal to the muscle isn't right. It can be hyperexcitable and cause cramping. Also, neuropathy can cause cramping as well. And the most common cause of neuropathy is diabetes. So a lot of diabetics do have muscle cramps. And with neuropathy, the sensory type of neuropathy, which is the more common type of neuropathy, can feel like a muscle cramp, but is not. So muscle cramping involves the seizing up of all the muscles, and your foot's like stuck in a position and you can't move it. But with diabetic neuropathy, you can have that same cramping feeling, but not the seizing up of the muscles. So with the neurological cause, your doctor has to figure out what's going on, and he has to treat the back pathology. With the neuropathy, they normally treat that with medications. Gabapentin helps to calm down the excitability of the nerves, and therefore there'll be less cramping. They commonly do not use muscle relaxers like Flexeril or Soma for a long period of time because they can be addictive. So they're used in the short term. Now, the bad news is that you can have more than one cause of muscle cramping. So you need to work with your doctor, and the doctors are really good detectives. They're going to delineate what's going on and help you out. One thing I have my patients do that doesn't involve medications, but it just helps the muscle relax before you go to bed. Doing like a warm compress, like soaking a towel with warm water. You can even use Epsom salt. Epsom salt has magnesium in it, which may or may not help soak in there and relax the muscle. But just wrap it up, or even get in a bath for about 15-20 minutes, and just that heat will just relax the muscle. And then also you can even do like a little massage or foam roller of your gastrosoleal muscle belly, or a golf ball on the bottom of the foot, and press down with your foot on the ground and roll it around, and that'll massage the little muscles in your foot. You can even use your fingers and massage it. And after this, I have my patients just do some Achilles tendon stretches, maybe a set of 10, holding the stretch about 10-15 seconds. And that'll just help the muscle relax, and so you can go to bed, and then it hopefully won't cramp up. And most of my patients do well with that routine. You can even take it a step further and get a night splint. You can get them on Amazon. They're a posterior night splint. They go in the bottom of the foot and up the back of the leg and hook on with a Velcro closure. And that holds your foot at 90 degrees, and that'll be less likely to cramp in that position too. There are certain topicals that might help with muscle cramping, like BioFreeze, Arnica, Aspercreme. You can use that when you're massaging your muscles at night. There's also a spray that's been touted to help with muscle cramp called TheraWorks. I'm not sure how well it works, but they say it helps with muscle cramps. And then, of course, work with your doctor for any supplements you need. Magnesium is a common supplement to help with muscle cramping, but you need to work with your doctor because you don't want to get your electrolytes out of whack and mess up your bodily function and end up in the hospital, or even worse. So work with your doctor and maybe get on a regimen of supplements or perhaps a medication to help you. So if you've gotten value out of this, please like and subscribe, and let me know in the comments if you've been suffering with muscle cramps and what you've done about it and how you were helped. And thanks so much for watching. We'll see you again next time.
Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.